This is part 2 of COVID Long Haulers self-documentary. If you haven't already watched my part 1, check out my Instagram platform under the IGTV video series. You can also go to my podcast on Spotify, Self-Discovery, and you can see my COVID-19 infection, self-quarantine, and journaling. Last time where we left off was my cardiologist had me wearing a heart rate monitor, or it's called a heart Halter, to see how my heart patterns would be at rest, when I'm sleeping, when I'm exercising for 3 days, and then decide if I needed a specific beta blocker. My cardiologist also ordered an echocardiogram, so a ultrasound to see the structure of my heart, just to make sure there wasn't some sort of abnormal functionality that we didn't know about going on in the beating of my heart. My autoimmune panel was pending as well for my primary care. With COVID-19, there is a lot of overlap between autoimmune disorder. We're not sure if it's the virus triggers the body to attack its own tissue and autoimmune response, or if there is a mild version of an autoimmune disorder and then it gets exacerbated by the virus. So I was waiting at home for all these results, and what I did know is that my primary care told me most likely the diagnosis I would have is POTS. We all are learning together. So POTS again is Postural Orthostatic Tachycardia syndrome, where you're not able to lay flat or sit or stand very well. The body has an overactive response to blood pressure regulation based upon your body position. My cardiologist told me I was having major issues regulating my own blood pressure, which the body typically does naturally on its own. And I had a heightened sensory response, which is known as dysautonomia, where your body typically balances parasympathetic and sympathetic functions in the body. And it seems like my body was having an overreactive response, kind of a fight or flight response naturally kicking in, even though there was no stressor in my environment. There's a YouTube video by Dr. Hakim about autonomic dysfunction, that's a mouthful, that I'm going to link into this or add a screenshot of that into this presentation for you. So again, my body was having an imbalance between sympathetic and parasympathetic, the systems in the body. Sympathetic is kind of that fight or flight, so if you hear something, the body can run, the heart rate elevates, your breathing increases. Parasympathetic is kind of the rest and digest, so anything that you eat, how your body creates, digests, metabolizes, all the way to using the bathroom and sleep patterns, things like that. So the results, once they did come back, was my heart rate Halter. The heart Halter showed that I had inappropriate sinus tachycardia, or IST, and PVCs. So what that really means is it's a type of heart rhythm abnormality called an arrhythmia. Basically, my heart was beating faster than it normally would for no apparent reason. So I could be sleeping and my heart would be beating out of my chest and wake me up. I could be eating, I could be standing, and it's not because I was in a really strenuous or stressful situation. It is a type of dysautonomia, and while it's not life-threatening, it can have a major effect on your daily life and quality of life, and they actually compare it to people with end-stage renal disease on dialysis or someone with congestive heart failure. I'm inserting some photos that you can refer to that talk a little bit more about the inappropriate sinus tachycardia. My echo came back normal, so a really wonderful, talented technician did the ultrasound on my heart. She was great because she told me, don't let anyone tell you it's in your head, because it's not. This is real. When it comes to the heart, a lot of times people can say, oh, if you have a history of anxiety, it must just be your anxiety disorder. And she's like, no, you know your body, and now you're getting like the evidence to support. And the nice thing is with COVID, so many people are going through these experiences. There's a lot more research and medical support behind it. So the echo came back normal. My autoimmune panel came back normal. Great news. but the heart Halter showed that tachycardia imbalance. So my doctor started me on a beta blocker, small dose every morning. I'm not going to give you specifics on medications or dosing. That's something, if you are going through something similar, you should be working with your primary care physician or specialist. And again, all of my video series that I create are just here to support the community with my own personal story, not for me to be acting as a potential treating clinician for your concerns. So always reach out to your own healthcare provider. During the past 5 days, some of the symptoms I was struggling with that correlates with that dysautonomia is having a really difficult time regulating my temperature, having heightened awareness to sounds, noises, light. If I do have caffeine, coffee in the morning, my brain literally hurts and everything is exacerbated. My thoughts are deeper, my heart wants to race faster. My GI pattern is up and down. My ability to read my body and know like when I'm hungry, when I'm full, all of those things I've worked so hard in my past to self-master with my eating disorder history. I had to start to use the logical part of my brain again to say, okay, you may not feel those clear signals coming from your body when it needs more water, when it needs less water, when it needs more food or it needs less, but I can know what my pattern is and what my body truly needs logically, while my innate system is not able to as clearly communicate to me. I also was having some swallowing difficulties. I almost felt like I was drooling sometimes and I couldn't control the saliva production. I also had the sensation that someone had punched me in the nose and I almost tasted like bloodiness in my mouth. And I had the urge to go to the bathroom more often. Or normally if you're super busy, you might like every 4 hours stop to use the bathroom. It's almost like every 45 minutes I had that urge to go, but I really didn't need to go. So my body was giving me important information, like something is imbalanced, and it was just very strange to observe the new symptoms. Okay, so what helped me during this process, no matter what challenges we have in our life, and for myself, I always pray to God, and God told me nothing needs to change with your approach to self-soothing right now. Continue doing what has worked in the past. I've just had to become even stronger with these techniques. So first of all, I use some of my dialectical behavior therapy techniques. I talk to myself in a very gentle voice because it can be really easy to judge yourself, shame yourself, set really high standards, like you have to be stronger, you need to be feeling better, be braver, push yourself, get back to work sooner. You can get through this workout, instead of gently saying, okay, body, what are you feeling? What do you need from me? And that's truly what you have to do in these intense situations. I'm able to put on my observer hat or my observer glasses and kind of watch these intense emotions come through and ride that wave of emotions and just let it pass. So before I really understood the power of that technique, I would feel a sensation like, oh my gosh, my heart's burning at my breastbone, and I would like freak out, oh my gosh, am I okay? And instead I'm like, no, objectively I've been checked out by my clinicians, my heart is structurally functioning well, my body is not in a state of inflammation, it's getting better. I have a new medication that is going to help regulate my blood pressure, and I'm going to have some new sensations, but there's a range of safety. So if I feel these things, it's okay, breathe through it, they will pass through, and I will be okay. I've had, a month and a half of going through these symptoms, and the feelings come on strong, they're scary, they pass through, but every time I do pass through, and I am okay. So just using that wise mind and walking the middle path and just observing these new experiences and setting a new normal, so learning to be comfortable in that uncomfortable range has been so therapeutic for me. When I hadn't been to my doctors and I didn't have the entire understanding of my new conditions, I learned a cope ahead technique. So if I were in a situation where my symptoms got really overwhelming and what I knew how to do wasn't working to calm me, I had a cope ahead plan in place where I would talk to myself, put myself in a more comfortable body position, call David or a family member to help me out if I need it and take me to urgent care, where last time I was at urgent care, they were so helpful and everything worked out. So I look at like what would be the scariest fear, and it still is going to be okay. That cope ahead technique. If I'm running in my head and kind of going down that path of fear and I'm not okay and I'm feeling like disappointed that I'm not healing quicker or better or I'm stronger, I get really quiet and I connect myself to my heart. Sometimes I'll just put my hand on my heart and then I'll just talk to God or source or whatever you believe in your spirituality is, and just say, I need your extra help right now. I don't have this technique down pat, or I'm not strong enough in this situation. Can you provide some extra peace and guidance? And when you get really, really quiet and just connect to your heart and soul and breathe, the answers and guidance do, just like in a really warm way, come through to help you out. I also am kind to myself. So it can be hard when some people don't understand what you're going through. So I will try to insert compliments into my day, or kind of like God, that loving voice, would just be talking to me like, I'm so proud of you. You're such a brave woman going through all of this. You're getting so much stronger. And because of that, you're being a blessing and giving back to others. I'm really, really proud of you. And we're going to get through this. And the feelings will pass through. You're going to be okay. And even if it is a new normal, we can, no matter what, have a really happy, wonderful life. We just might have to put a little spin on it. So I'm trying to always look at the positive. What also helps is petting my dog, doing soothing things to help my body get out of the fight or flight and get more towards that parasympathetic, calm, soothing. And then so many silver linings that I discovered along this journey, where I have an even deeper connection to empathy with my patients, because I'm experiencing more of those symptoms that they go through. I had never personally felt all of them. So I'm even more proud of the role that I play in the medical field. I also realize that I'm gonna have a lot more life skills that I'm even stronger in, because when your life feels like it's on the line and you have to dig so deep in your faith and your spirituality and soothe yourself in a way that world, God, life has never asked of you, you become even more mastered in those skills. So I'm looking forward to teaching others to be the stronger version of themselves. And just respecting life, you know, when it comes so close to potentially passing through to wherever we go after this lifetime, and kind of getting back to your health and starting to feel like yourself again, you cherish life at a whole different level when you realize it was almost taken from you. All right, guys, thank you for your time. And please share this video with others out there that may be going through something similar. Maybe it's not COVID related, maybe it's a different medical condition, or just mental health challenges, a passive eating disorders, whatever it may be. You're not alone. We don't talk about these things enough, so you feel like you're abnormal, but you're completely normal. And I love you, and I'm thankful for everyone out there who is listening. And I look forward to creating another video update once I feel like I have some new news to share. All right, guys, take care.